Welcome, everyone, and thanks for listening to Sports Doc Talk. Be sure to check us out at sportsdoctalk.com. I'm Will Sanchez, and once again, we are so thankful and grateful for everyone listening and checking out our websites. And I think Dr. Garcia promised the next 1,000 fan to listen to our show a miniature pony, but we'll bring him on in a second to confirm that. So we're just so excited about it. We have a great guest today. But before we get to that guest, Dr. Garcia, can you confirm, are you giving out miniature ponies for our 1,000 listeners?
I wish I had 1,000 miniature ponies. So I can't confirm that, but it is a good idea.
Listen, we're really excited about today. We have a big component of what you talk about, seems like every single show, and that is the work that you do, getting to the patient, repairing them, getting them back to where they need to go. But really the next step is your handoff to someone that really does the work as far as physical therapy and putting in all the work that has to go into recovery so they can get back to normality. And we have an exciting guest today. Dr. Garcia, please introduce our guest. And before you do, please explain a little bit more why it's so important to have a physical therapist to get you on your road to recovery.
So, we thought about this show, and you guys all hear the fancy stuff that we do, the cutting edge procedures we do, how we're trying to push the envelope. And yeah, that's all well and good. But, my surgeries, hopefully anywhere between an hour to 2 hours worth of work. There's some pre-discussion, but really that's it. Most of that's handoff, and the handoff is to physical therapists. And if you don't have a good team, you'll see pretty quickly that despite how good a surgery you do or whatever you do in the operating room, it really doesn't matter if you don't have a good team. And so, being now in Seattle for a little while and getting to meet a lot of good physical therapists, there's just some really high quality places that I think really will help things. And also we need those difficult situations where you need to have second opinions for physical therapy because the thing's not going the way you want. I've got my go-tos. Tonight, I'm really excited to introduce Zach. He's one of the co-owners of High Def, and he's really been instrumental in helping me take care of my patients. I know I've sent plenty of patients his way, even for second opinions on top of my standard surgical patients. So some of my patients will drive an extra distance just to see him and his team, and they take care of anything. There's sometimes you have in physical therapy, the procedures that we do are unique and they're not commonly done. So you see a meniscus transplant, you see a cartilage transplant, and that can make people nervous as they rehab. But this team does not falter, and I've never had any issues before, and they've taken care of plenty of those patients of mine. So it's a pleasure to have them on, and I really want to talk about what cutting edge stuff that they're doing to help our patients get ahead and with our better outcomes. Because again, all these athletes you're seeing online, Aaron Rodgers, Nick Chubbs, you name it, Lonzo Ball is going to come back from his cartilage transplant. Most of that work is getting done by amazing physical therapists. So thank you, Zach, for being on here, and love to hear more about your stuff you're doing.
Well, thanks for having me on, and I appreciate you guys taking the time to bring me on here. And I've had nothing but positive experiences with you and your team, and never hesitate to send people over. I know you guys are the best in the business over there. So we've enjoyed being able to be on the cutting edge of medicine with you and bringing some of the passion that we have for sports medicine and recovery of some of these complex surgeries. And so it's been a really fun thing to work with you and your team. I was actually just online yesterday watching a bunch of your surgeries that you're doing. So I've been loving what you've been doing with taping the surgeries. Sometimes I'll be at parties and I'll be watching your surgeries, and people will look over at me and they'll see that I'm on a phone looking at surgeries, and they're like, what are you doing? And I'm like, hey, come over here. You got to see this. This is Dr. Garcia. He's got these surgeries that he records, and it's really well explained. And so, yeah, I'm even bringing some of the people that are not in the medical field into the fold on some of the stuff that you're doing. And so thank you so much for having me on, and I'm looking forward to it.
Awesome.
It sounds like Zach's hanging out with a bunch of guys like myself, just kind of randomly looking at these surgeries, these internal brace. That's my thing right there. So Zach, I can relate. Zach Smith, he's a physical therapist and co-owner, like Dr. Garcia mentioned, at High Def PT. That's HIDEFPT.com. So you could check him out and check more information out there at his website. Dr. Garcia, please continue.
So, I think I want to know more, and I kind of talked to Zach about this, and I'd like to know more about like, what do you guys do? How do you guys do it? I've told everyone kind of my backflow and my secrets to sort of how I try to stay on top, but I'm not as experienced in the PT world. I know I send them to you, you do an awesome job, and the patients come back looking really good. But what does it take? What does it take for you guys to stay on top? And you kind of explain your methods and what you're doing that's new.
Yeah, I mean, the first thing is, I think what it takes is consistent team effort on education and keeping up with the latest in what's going on with surgical techniques, with rehab and performance and all of that. So I think in the Pacific Northwest, like you said, there's so many great clinics. And so we're just happy to be a part of the community of PT here up in the Pacific Northwest, because there are so many good physical therapists up here. And really what I think has led to us being one of the leaders in sports rehab and performance has just been our attention to education. So like this upcoming week, we're bringing in a course from a guy named Tim Gavitt, which is all about load management. He's a legend in the field coming out from Australia. We host a lot of courses on a variety of different topics. And then on top of that, our team stays up to date by bi-monthly full company-wide meetings where we review journal articles relating to new stuff that's coming out, maybe some old stuff as well. We go through case studies and case reviews. So some of these more difficult surgical procedures, some of the harder rehabs and the more complex patients, what we'll do is someone will present that case at our bi-monthly meeting, and we'll get weigh-in from all 11 of our physical therapists. And plus, we bring people in like yourself to help educate our physical therapists on these procedures and help make sure that, we do right by the patients, because, there are the simple, straightforward procedures like, meniscectomies, total knee replacement, total hip. Like some of those are kind of, they're fairly simple, they're fairly routine. We kind of know what to expect unless we get a curveball with some of the healing processes. But with things like, complex ACL, even like a simple ACL, that's a complex rehab. And if you don't know how to test and make sure that you're loading the knee correctly through that rehab process, there could be a lot left on the table as far as like return to sport timelines. And you're seeing guys like Jordan Brooks returning to practice at 6 or 7 months, returning to, I think, full play at 8 months. And I think a lot of that type of faster return to sport, not that it's always advised early on, like that early, right? But a lot of that is because of dedication and time spent and diligence with physical therapy, not just on our side, though, from the physical therapy and clinic side, but also helping to make sure that our patients are also well educated and well motivated to make sure that they're doing the rehab, because something like an ACL, that takes a lot of effort, right? That's, I've got patients who are professional athletes where it's their full-time job is now an ACL recovery. And so when we have patients that take that sports mindset, that like they attack the recovery, we see really good results. And so we really try to bring that level of energy and effort into the clinic, and everyone who comes through our doors is treated like an athlete. And that mindset helps us to propel these people forward. They're in 3 of our 4 locations are inside of gyms. One of them is a standalone, but looks like a gym. And when people come in, they don't necessarily feel like they're in a medical center. They feel like they're in a training facility, which for a lot of these injuries, right, we don't want to push people too early. We're always safe. We make sure we respect all the protocols and all of that. But when the time comes to load and make sure we have adequate load for adaptation, you've just got to really understand how to do that and how to do that safely.
I think that's a great point. I mean, I think you made a number of excellent points. I think the one thing is education is really important. And I find that you have groups that are maybe not as up to date, and you have some groups that are. I mean, the reason you guys will get a weird, they'll get a bare ACL, or you'll get a meniscus transplant, or you'll get a cartilage transplant, you get MPFL, or you get a revision ACL of mine. And there's really not many questions if you follow the protocols and you do your education. And I think that's really nice. Like, I love being able to teach those sort of more complex things, but it is nice too when there's some breadth of knowledge. Even the fact you're joking about the videos, you clearly care enough to watch them to learn about it. And so that's really important. I think for me, when I'm handing off my patients, I want to know, we've all heard the stories before. I have them, plenty of them. Patients come back and said that the person they worked with didn't have any idea what type of surgery they had done, even though we had sent them with operative notes. And, it's not to knock anybody. It's just that that's hard for me when I do a lot of work and I'm spending a lot of difficult, time doing this. And so it's good for me to know people that really care about the education. It's good for the patients to know that too. This, there is a difference between good PT and bad PT. And if your therapist's on board, if you care about it, you read literature, you understand how things are adapting, that's good. And two, you know me, like I'm okay with feedback too. You're like, hey, listen, Dr. Garcia, you're not really, there's some newer things that we're doing. Like, have you thought about this? And, oh, that's a really good idea. Thank you. Right. Like I can't read every paper, just like you can't read every paper. So we're here as a team.
Exactly.
And I think we drop our egos because all we care about is the patients. So that's really important. And the ACL thing is like, you're dead on that. I mean, there's patients that don't get the athletic mindset early on, and it's a long recovery. And when you have that athletic mindset, you can do big things. The one thing, you probably heard me ask the patients before is like, how is your testing? And they'll be like, what are you talking about?
Mm-hmm.
And if I get them from someplace like yours, they got their testing with them as a sheet. They've had everything done and they know they're ready or they know they're not ready. And that's really important too. And so that's just the basics of just ACL in general. So I don't mean to interrupt you too much, but yeah, that's important.
No, that's perfect. And really that points to like one of the things that we try to stay on top of, which is, you mentioned the testing. And when we talk about testing, we talk about the main one for ACL is quad testing with dynamometry, isokinetic strength, isometric strength. So we test at 60 degrees, and we try to take more of a criterion-based measurement of progress, right? There's constraints from the physiological healing side, and then there's constraints from a strength and performance side. And so what we try to do is try to marry both of those concepts and make sure that, hey, we're not stressing the graft too much in certain ways, or like a meniscus repair, right? We can't load it in certain ways, but we want to make sure that if we can load something, that we're not just fearful of, hey, we can't load, anything, right? So someone that comes in with a meniscus injury and they've got a brace locked, there's no reason they can't do hip and core work. There's no reason they can't do upper body strength work. All of that helps to stimulate their body and keep them from atrophying elsewhere. So one of our big focuses is on hitting other areas, right? So they come in with a knee injury, we could still potentially work ankle, definitely hip, definitely core, and upper body. And so that's one of the things we work on. And then with the testing, we've also got a very stringent return to sport testing that we utilize. So there's a lot of testing out there. Vail Sport Core test, which tests basically muscle endurance and strength. We'll do some 1RM numbers, but there's really and some single hops and double hop numbers. But really the big one is, like you said, it's the strength number, right? So there's certain things that we want to hit, and if someone doesn't hit those numbers, it's going to be really hard to progress them in their program. If someone comes in and they want to start running at 12 weeks, but they only have a 50% limb symmetry on quad strength, that's going to be very difficult from my perspective. But very easy to explain to the patient also, and most people understand that because we set these goals and expectations up front. Hey, this is what I would like you to be at 8 weeks. I'd like you to hit 70% limb symmetry with your quad. And so this is the stuff that's going to take to get there. And if you don't do it, it's like a math test, right? You come in, we know that you haven't really done the work, or we haven't helped to guide you in that work to get you to that 70%, or there's something else going on, and we need to reevaluate our approach as a physical therapist in a physical therapy clinic of why we're sitting at 50% at 8 weeks, and maybe there's a pain issue that we need to deal with. Maybe there's some manual therapies or something else we can do, or maybe we need to do some more blood flow restriction therapy to help boost that strength in the early phases. And so all of that we try to take into account with the testing, but the testing really guides us and tells us, because there's been a lot of cases, on both sides where I get someone and I test and I anticipate that they're going to be very strong, and then we test them and they're not strong. And then we have to look and say, hey, why is this happening? Hey, we need to refocus. And sometimes it's a little bit of a reality check for patients, but in a good way, it helps them refocus, because if I wouldn't have had those objective tests, those numbers don't lie. And if I didn't have that test, I could have gone through 6 months of rehab, not knowing that, hey, the quad actually is not getting stronger. We're just working on, compensation methods through the hip and through the calf. And so there's a lot of things that we could do help to guide them in the right direction. But we have to know these problems are happening. And so like, obviously the easiest stuff is like range of motion measurements. Everyone takes that, but really this, like at most phases of the rehab, the strength and the ability to accept and load eccentrically, that's going to be the most important piece of this rehab process.
Hey, Zach, is this something that you're measuring day one? So let's say, someone like Dr. Garcia sends you a patient, they walk in through the door and you're doing this, whatever it is, dynamometers kind of measurement, that you're measuring the force and the power and what's the muscular strength. Are you doing that day one? And then how often, I guess, depending on the injury, how often are you going back to this test to see what the measurements are for the patient for you to figure out, you and your team to figure out that they're progressing the right direction, or you have to change course?
Yeah, for something simple like a meniscus, like a metastectomy, where Dr. Garcia doesn't go in and repair the meniscus, and we're not worried about tensile load on that meniscus, we can test them a lot earlier on, depending on the patient, usually like second or third visit. For ACL, we really don't want to test. There's really no reason to test until about 8 weeks. And so there's this period of time where we have to really motivate these patients within this early phase of rehab, because we're not even going to do that test. The knee is already, it's swollen, it's inflamed. The quad probably isn't even activating. The quad muscle isn't activating for the first few weeks very well. So we're using a lot of electrical stimulation and blood flow restriction therapy to try to maintain size of the quad. And so there's really not a whole lot of benefit to testing it that early on for us, as far as the numbers that we see, because a lot of it's going to be inhibited by pain and fear. And so at about 8 weeks, if we've worked them out correctly, we can get a very good, accurate number. I've seen numbers as early as 6 weeks on an ACL, and it's all going to depend on the protocol, right? So like a meniscus repair or a root repair, and Dr. Garcia, you might be able to speak a little bit more on this. We're not going to test those nearly as early because we can't load them into flexion, and so it's going to be a lot more difficult for that. And so there's other metrics that we can take, though, quad girth, like making sure that they're not getting so much atrophy in the quad. That, we know that muscle cross-sectional area is directly related to strength. And so we know if we have those metrics, we've got some idea of what's going on. And then after we take the initial test, it's every 2 to 4 weeks, and we're doing a serial testing, right? Because strength testing can go up and down by anywhere, like on a max effort day, plus or minus 20%. And so sometimes we'll test somebody and then test them 2 weeks later and they're actually down a little bit, or we test them in 4 weeks and then they've had a good restful night's sleep the day before and they haven't taxed their central nervous system. And then all of a sudden they've got a massive improvement. So we try to take regular tests throughout the process so we just can track it a little bit more like a linear progression, and we can really see what's going on like every few weeks. But really, like every week, we probably wouldn't get that much result with testing it week to week for the time sacrifice of it, just because adaptation of strength takes a while to gain, especially in the later stages of rehab. But earlier, definitely closer together helps us gain some valuable information.
Those are important points you brought up. The dynamometry is important. You'd be surprised some people don't do that, and I don't really get it. That's how I get the best test for me in terms of how people are doing. Because they complain, they'll say, "I've got some anterior knee pain. I feel weak," and I'm like, "What's your dynamometry?" And they just don't know because they haven't been tested for it. So it's really important. And I'm obviously not. I don't get that from your group, but that's an important thing to be part of. I think for Will, if he's heard this, he brought this term a few times called blood flow restriction.
Oh, baby.
This is a really hot topic, and this might be the internal brace of physical therapy. So if you don't want to listen up. But tell him a little bit about what your blood flow restriction is like. What do you guys like to use it for? It's a sometimes controversial topic. I'm obsessed with it. I love it. I would do it for all my patients if I can. I do think it makes a difference. I've tried it myself a few times. But maybe tell the listeners and maybe do help Will out too, so he can do his prescriptions for blood flow now.
Yeah. So blood flow restriction therapy is basically it's a class of tourniquet, but unlike in surgery where we fully occlude the blood flow to the extremity, we occlude a certain amount. So basically how it's done is there's a cuff that's placed up at the very top of the thigh, right by the kind of in the groin area, and it wraps around the thigh. And the cuffs that we have are very smart. They have a built-in Doppler and they have a built-in pump. And so they're completely wireless and they run the Bluetooth to our phones. And what we first do is we take your what's called limb occlusion pressure, and we figure out how much pressure does it take on this cuff to occlude all of the blood flow in your leg. And then the maximum at which we work is at 80% of occlusion. So we're not occluding full arterial blood flow, but we are occluding most of the venous flow. And so there's not a lot of return of blood from the limb. And so the science behind this is now very good. It's been mostly done in ACL cases. And we've shown that we can really slow down the rate and if not even pause the rate of atrophy if done early in rehab for post-op cases such as knee, post-op ankle, post-op foot. We usually use it. Our clinic is mostly using it in the lower extremity. We use it a bunch in the upper extremity though too, elbow, hand, wrist. There's even some good literature that shows that even though the cuff on the arm is placed at the armpit, it still has some effect because of the backflowing of the arterial system into the rotator cuff. And so basically what this does is it tricks your body into muscle hypertrophy. So there's 3 different ways that our muscles grow in size. And a muscle growing in size is called muscle hypertrophy. And basically there's 3 different ways. One way is by eccentric loading. So that's the slow lowering on a squat or a bench press. So we overload that phase of exercise and we underload the concentric phase or the up phase. That's one way. Another way is progressive overload. This is like the standard way that weightlifters get strong and big. They just progressively increase the weight at which they lift over time, right? Today I lift 200 pounds on bench press. In 6 months, I lift 250. I will gain size of muscle by doing that. The third way is what's called metabolic overload. And that's basically where the muscle produces a byproduct during exercise. Usually it's hydrogen ions and lactate. And those are a signaling mechanism for your body to increase muscle mass because your body is under stress. And so what these BFR cuffs do, the blood flow restriction, is they block the blood flow from going back up into the body. And so it pulls those hydrogen ions and lactate and all of the other metabolic byproducts of muscle activation and physical exercise. And so it stimulates this massive response where your body thinks you're doing a lot more exercise than you are, which helps you to maintain and activate your mTOR pathway, which is the pathway for increasing muscle size and strength. And so this is the basic mechanism. There's a lot of ways to do it. There's some rules around it, right? There's some contraindications. There's certain people that can't do it because of like things like, having a blood clotting disorder, being on blood thinners, things like that. There's a few things that, would preclude you from being able to do this. But most healthy people can do blood flow restriction. There's really not a whole lot of downside. There are some cases of a few injuries that have occurred with probably improper use and non-high-tech cuffs. But the cuffs that we use are very high-tech, very easy to operate, and they're fairly user-friendly. They're very user-friendly. And so some of the protocols that we do for blood flow restriction therapy is we do a little bit higher reps and lower weights. So some of the studies are showing that at about 30 to 40% of your one repetition max, so the maximum amount of weight you can lift, with BFR, you can get the same amount of muscle hypertrophy at early phase rehab as if you're lifting 80% of your one repetition max, about 80% of your one repetition max. And so the good thing is for things like ACL like people that have anterior knee pain, people who have had a meniscus transplant or a cartilage surgery that can't take a lot of mechanical load or a lot of weight load, we could do exercises with much less weight and get a similar result in maintaining muscle hypertrophy. And so that's been a huge piece of our post-operative rehab for both the upper extremity and lower extremity. Unfortunately, you can't do it for like core injuries and back injuries, things like that. Although I did have an interesting case of a guy who had a radiculopathy, an injury to the nerve that came from his lower back, and he had almost no calf strength. And we did BFR for 6 months, and he was able to produce body weight strength of that calf by the end of 6 months, which was very cool because because previous to that, he just couldn't physically load his calf enough because of the lack of nerve reception to the calf. So we've seen really good results with it, and it's just, another tool in our bag that we use early on, especially in post-op cases, to help people get back to 100%.
Hey, Zach.
Yeah, I know. I love it.
Yeah. Are there any restrictions? You mentioned certain restrictions when it comes to maybe the type of medicine you're on and blood thinners, things like that. And I know Dr. Garcia and I talked about BFR before and kind of going back to this Katsu training. But is there an age restriction? Is this for all ages, or is there a ideal age group that this would benefit?
No, that's a great question. It really could benefit from people from all ages. So I've used it up to people age 75.
Wow.
Obviously and unfortunately, as we age, people tend to gain comorbidities, and they tend to have, things like elevated blood pressure. They're on statin drugs. Maybe they've had a stroke in their history or TIA, and they start to gather these contraindications to blood flow restriction. So I think, as the population ages, you become a little bit less of a candidate for blood flow restriction therapy, but you're not necessarily precluded because of age. And then the younger ages, that's kind of an interesting topic right now going around. And I talked to a couple surgeons recently who say, hey, as long as someone is, 12, 13 years old, basically hitting puberty, I've got absolutely no problem with them doing blood flow restriction therapy. It's all about tolerance though, right? Because these cuffs at 80% occlusion of your lower extremity, we usually don't start at 80. We start to get them comfortable at 60, then we work up to 80%. At 80%, those cuffs are tight. And maybe, Dr. Garcia, I'm sure you felt this too. It's not the most comfortable thing in the world when it's pressurized around your thigh and squeezing. And so, some younger kids wouldn't have as good a tolerance to it. And some people in general don't have as good a tolerance to it. But I'm always surprised when I'm like, hey, I warn people, I say, hey, this is uncomfortable. Let me know if it bothers you too much. It's not 100% essential to your care, but it will definitely help you. And most people are able to just, hey, I got used to it and now I love it. And we have a lot of patients that actually end up buying the cuffs for themselves to continue to do their workouts because, they love the results so much.
And that's a big thing, Will. The people do that all the time. I hear that they come in, they say, I bought my own because I was so happy with the results.
Yep.
It's a big deal. And for me, it's one of the, if I've got go-to PTs, I really want to make sure blood flow restriction is an option for the patients, especially when those patients, they're 4 months out, Zach, and their quads don't look great and their ACL, and you're like, are you doing blood flow? And they said, no, I've never tried it before. And to me, that's a concern, right? I'm also concerned if they say they are doing it and they look weak, but I don't tend to see that as often. Again, anecdotal, one surgeon. But I think it's important, and it's a real thing. And I have a couple of videos of me doing it, and there's a burn. Will you feel like you feel very weak within a couple sessions when you start doing it?
And I actually do it a lot myself. Yeah, I do it a lot myself. I've had knee surgery on both my knees. I've had posterior patellar surface cartilage injuries, osteochondral defects, and so like injury to the cartilage behind my kneecap. And one of my training tools when I'm doing knee load to maintain quad size, especially on my right knee, is blood flow restriction. And yeah, even just cycling for 15 minutes with blood flow restriction cuffs on is, even on light resistance, it is a massive field of workout. Like your legs are on fire by the end of it. And the great thing is you don't have to load the knee. So my knee never hurts after I do BFR, but my muscles are always sore. And that's a sign to me of something that I need to be doing for my own personal knee. And I know that a lot of my patients experience the same thing where they say, hey, yeah, my knee didn't bother me at all, but my glutes and my quads and my hamstrings are really sore, but like in a good muscle way that I haven't gotten to feel for a while.
Yeah, it sounds amazing. I mean, it sounds like we should do an experiment, but that'll be a conversation for another day. For my birthday, my buddy sent me I'm looking at it right now, MetaQuest 2 VR, going into 2023 and beyond, right? We're seeing Apple jumping on it. Obviously we know about MetaQuest, and I know that virtual reality is something that you're dabbling in. Can you explain a little bit about that? Because virtual reality is just, it's the future and it's here, and I can't imagine where it's going to be 5, 10, 15, 20 years from now.
Yeah, so we're using VR kind of in a way that you probably wouldn't expect. So I think there's a lot of cool applications. Some of the stuff that we don't do, which I think we will now that we actually have someone who specializes in working with amputees, is working on limb reintegration of like sensory stuff. So like phantom limb pains that people have, there's some stuff coming out with VR technology and using VR to reduce those phantom limb sensations. What we like to use it for right now currently is what we call sensory reweighting. And so basically when you get one of these lower extremity surgeries, like an ankle surgery, a knee surgery, hip surgery, you lose something called proprioception, or you diminish your proprioception. You don't lose it fully. But what happens is, because you've had some disruption to the mechanoreceptors, or the things that recept information from your leg, like sensation, that's disrupted. You start to reweight your sensation or your balance system to the other two systems. So there's 3 ways that we maintain our balance. There's your vestibular system, or your inner ear, which basically helps you to sense the horizon. And so, some people get vertigo. They have a disruption of their vestibular system. You've got your proprioceptive system, and your proprioceptive system basically senses where your position is in space, right? So you've got your feet on the ground, your skin is in contact with the ground, your foot is flat because you can feel that. Your knee knows that it's slightly bent because you've got mechanoreceptors in your knee. And then the last system is visual. And the visual system is obviously, like, if anyone's ever tried to balance and close their eyes, it automatically becomes harder because you've removed one system of balance. And so what we do is we put people on hard surface with a bare foot, and we start to try to reweight the system back to the proprioceptive system. So after you've gotten one of these injuries or surgeries, your body is relying heavily on your vision and on your vestibular system. And so especially, like for older adults who have vestibular dysfunction, but even like in dark situations, you'll notice that people are more likely to fall and get injured in the dark because they don't have good proprioception, and now it's dark, so they've eliminated their vestibular or their visual system, and then maybe they're turning their head, so their vestibular system has changed, and they're more likely to get injured. And so what we want to do is we want to try to start to get that sensation back into the proprioception, so that person can sense what position their knee, their foot, and their ankle are in relative to themselves, so that their injuries are less likely. So what we do is we put someone in a VR headset, and we have them do things like riding roller coasters, or we have them do like mazes and courses, or we'll have like they'll be watching gymnastics and people will be flipping. So basically we're removing the visual system, or the actual visual feedback that's happening, and then that change in movement from the roller coaster also helps to disorient the vestibular system, and it makes them rely very heavily on the proprioceptive system and what type of feedback they're getting from the floor, through their foot, through their ankle, through their knee, through their hip. And so that's a lot of what we're doing right now as far as balance training in VR. And it's incredibly difficult. I've ridden a lot of roller coasters now with a VR headset on, standing on one leg. And it's incredible how much of a deficit you will pick up in someone like my right knee versus my left knee because of my surgeries. My right knee, when I first started this, was incredibly diminished with proprioception, which led me to understand that, hey, my quad strength and my lack of proprioception is leading to continuous injuries in this leg. And so if I want to try to prevent continuous injuries in my knee and my ankle on my right side, I got to make sure that my proprioception is up up to par, and then I reweight a lot of my balance from my visual and my vestibular system. And so there's a lot of ways to do that without having VR. It's just a really cool and fun and engaging way to do balance rather than just having someone stand on their foot, eyes closed, and turn their head, right? So it becomes a lot more engaging and fun for patients to gain back their proprioception.
That's a great point. I hadn't heard that before. I know a lot of stuff you're talking about, but that technology sounds incredible, and it's a nice option. And I've been injured before too, and I've noticed that when my eyes closed, one of my legs is not as strong as the other in terms of balance. And I might have to watch some more roller coasters to get stronger now that I hear this.
It sounds like a trip to Busch Gardens. Let's just go and do it for real. Anyway, I know you've got a lot of stuff going on with PT, and you have some other technology. You've partnered with Theracentric, and it seems like this is an app for exercising for patients at home. If you want to talk about that a little bit and describe kind of like what is the benefits of patients having access to something that they can do at home?
Yeah, I mean, like Dr. Garcia said about his surgeries of 2 hours to 3 hours of work when he's doing surgery. With physical therapy, the maximum amount that I'm going to have somebody in is 3 times a week, for 45 to 60 minutes, depending. But the typical person is really only going to be able to make time for 1 to 2 appointments. And so out of your entire week and the amount of workouts that you have, 1 to 2 times a week is just not enough. And so if you really want to get the results and you have a high level goal, right? Like you have an activity goal. Hey, I want to be able to hike up Poo-Poo Point on Tiger Mountain, or I want to be able to jog a 5K, or I want to go back to basketball or tennis. Then, you've got to work outside of the clinic. It's not just about what you do inside the clinic, because if you rely on just what you do inside the clinic, you're definitely not going to achieve the result. And so we have partnered with several physical therapy exercise apps in the past, and this one is definitely the best that we've had. And it's great. It gives access to patients anywhere they go. Everyone takes their phone, right? Like if you give someone a printout, or even yet, some PT clinics are still drawing stick figures, which is fine, right? Like if that gets the job done, if it actually gets the job done, that's fine. But the nice thing is with our app, you've got videos of every exercise. It'll time your rest breaks. It'll help you count your sets and reps. It's very smart how it'll guide you through. It'll help you motivate. It gamifies, streaks of getting into physical therapy exercise and your home exercises. And so all of that combined helps people be more successful. And the cool thing is that I love about this exercise is that I can, on the spot with HIPAA compliance, so I can be compliant with the medical laws, I could shoot a video of you doing your exercises and put them into your own exercise app. And so you could see me, or you could see yourself doing your actual exercise. So instead of a patient taking these videos on their phone and then trying to figure out how many reps and sets, we can actually integrate these videos right into the app where they see the reps and the sets and the rest breaks and all that. And then when they pull up the video, it's a video of them inside of our clinic doing that very specific exercise. And so that's the great thing is like, if we come up with a unique, very customized exercise for somebody, then we could say, hey, this is exactly how you do it. And when I voice over the video as I'm shooting the video, they get the very specific instructions. So every time they're at home, they hear me coaching them through the exercise, or they can hear me coach them through the exercise if they want. And we found that our compliance rate with home exercise programs has over doubled since we switched to this technology-based home exercise program or higher tech app. And so like, if I can get somebody at 70%, 80% compliance with home exercises, we know we can do a great job versus industry average of 30%. It's really not enough load to get the adaptation that people are going to go for, especially if you're trying to get back to an activity.
And I think that's a good point.
Go ahead.
I think it's a good point that the number of patients I see that, they kind of forgot about the home stuff and then just do the PT at home, and then as your insurance starts to run out towards the end of the year or by the end of your surgery recovery, the home stuff is really important. So I think it's good for listeners to hear that there's a better option out there than just stick figures or print offs. I mean, I've seen the same thing. My family members have gone to other PT places just because it was closer. Not that they shouldn't have gone to high def, but nonetheless, when they go there, we get printouts, and they're going to lose those things. I mean, first time my mother-in-law brought home printouts, they were lost within 24 hours. And so the online ability.
Don't get yourself in trouble, Dr. Garcia. They may be listening.
I'm not getting myself in trouble.
Okay.
I'm not getting myself in trouble. I'm good. I'm always in trouble though. Let's be honest. So but it's important. It's important, and that's a really good thing for the patients to know that there's a high quality app out there that'll make their lives easier and get them back faster, which is, again, that's the whole point of our show. That's the whole point of what we do. That's the whole point of what you do and what I do. We try to find a way to get our patients back faster, be more compliant, do well, and look good. Because honestly, if they do their homework, it's going to make you look good, and it's going to make me look good. And let's be honest, those are all important things. So the key here is all patient compliance is important.
Yeah, and there's one more thing on that printout thing. The thing that always got me with those printouts is that you have a picture of the start and you have a picture of the finish, but you miss everything in between those two pictures. And that's really where the money is in execution of the exercise and knowing that you are executing it correctly. And people also feel more confident when they can see the exercise and they also hear the explanation of the exercise and they go, oh yeah, I remember when he said that to me in clinic. This makes all the sense in the world. Versus back 4 or 5 years ago when I was giving out printouts, people would come in and they'd be like, yeah, I've been doing this right the whole time, and I'd recheck it and it's just completely off. And not that there's not variation to exercise, but it's like some of this stuff would be completely, like this wasn't even close. And so that's really what I've loved. And then also on our end, we get to see when patients log in, how many exercises they've done, how many sets they've done, and I can see how many minutes they've spent in the app. And so I can really help to hold people accountable, which is kind of the way that I think physical therapy should be going, is into not just rehab in the clinic, but health coaching somebody through their entire journey of physical therapy and helping them to stay motivated. Because I know I like to work out, I like to get in the gym, but I always train better when I've got a coach or someone looking out for me, or I've got a workout buddy. And so that's what I think that this helps us to bring is the accountability side and people feeling like, hey, this person's in it with me versus, hey, I see this person once a week. And then when I'm not in there, it's kind of out of sight, out of mind.
Exactly.
This is Zach Smith, physical therapist and co-owner of High Def PT. Check him out at HIDEFPT.com. Zach said it earlier in the show. If you go to his Instagram and check everything out that he's posting, some really cool stuff. But he mentioned in the beginning, it's walking into a gym. It looks like a gym. It feels like a gym. And they're getting to work like a gym. Zach, thank you for your time. We really appreciate everything. And please check out his website. Reach out to him. We need to get into a bunch of other stuff and dry needling. And God knows we could have gone on and on. But please check out his website. Reach out to Zach and his team. They've got a lot of great benefits. Obviously, Dr. Garcia loves dealing with him, sending his patients over there because they know they're in great care. Zach, thank you so much for your time. Thank you for being with us today.
Will, Dr. Garcia, thank you guys so much. I appreciate you having me on this phone conversation. We'll have to run it back again. I've got some questions for Dr. Garcia, and so I think we could jump into some cool stuff. I appreciate you guys, though. Thank you.
Awesome. Yeah, no, thank you. I know we always, every time we do this, Zach, we always have like a million things afterwards, a question. So let's do it again for sure.
Yeah, let's do it.
Okay, take care, Zach. Bye. Dr. Garcia, great show. Most important thing that I want to kind of, relate to the audience, and you talk about it, Zach's talked about it, is the physical therapy part of what we need to do, right? When I tore my Achilles, when I've had injuries, I've had surgeries, the only reason I've gotten back is because I went to physical therapy and I was diligent about it, right? And I went home and did my homework that was put out there for me. And now, like, my left leg that I had my Achilles injury, my rupture, is stronger than my right leg because I worked so hard at it. And I did ladder drills and did balancing acts and single leg exercises and all these other things. everything. So I just want to reiterate to everyone out there, you get what you put into it. And if you put the work in post-surgery, you're going to have great results. Dr. Garcia, as we wrap it up, last thoughts on this show.
Well, it's incredible to hear all the technology coming out there. And again, I completely second and third what Zach and you said about compliance. It's really important, and it's good for our patients to hear and listen. If you hear something, if you're dealing with some problem or either non-surgical, surgical, and you're feeling like you're not getting what you need, there are places out there that can do it for you. Or if there's certain things that you're missing, there might be, we know our bodies, and it's important to understand that there's technology out there. That's why I do all the marketing for myself, because patients are understanding out there. I mean, I've saw multiple patients even today that we had technology we've been doing for the last few years, and they had no idea they could have saved their knee with this opportunity. So it's just more information gathering for patients to teach them, so they're learning better and they're understanding what gets them back in the game. And in the end, like we said before, patients first, getting them back to things they love, because when that patient comes back and they say they're back to everything, that smile on their face, it's worth everything.
For Will Sanchez and Dr. Garcia, special thanks to Zach out there. And I promise Dr. Garcia is going to work on getting that miniature pony out there for our listeners. Don't blame me, blame Dr. Garcia. We appreciate you listening. Thank you for listening to Sports Doc Talk. Dr. Garcia, have a great night.
Take care.